Hi, Susan. Thanks for being here. We're joined by Susan Wallace, who's the NDP candidate right here in Toronto Centre, downtown, in the upcoming federal election that looks closer by the day. Thanks for being here, Susan.
Thank you for having me.
Today we had a report out of a parliamentary committee that basically agreed with the Speaker, found the government in contempt of Parliament for failing to give numbers to go along with its tough-on-crime legislation, that is, failing to tell the public or the members of Parliament what this legislation will cost, and also for failing to let Parliament know what the new stealth fighter program is going to cost. What do you think's next, given this report out of the parliamentary committee, Susan?
Well, obviously, next is going to be a vote on that motion and also the budget tomorrow. So it's going to be an exciting roller coaster week in Parliament.
It certainly will be. Speaking of the budget, I know the NDP had indicated that they might be willing to support the budget, provided that it eliminated the GST on home heating fuel, that it provided some relief for low-income seniors, and that it expanded the Canada Pension Plan. How likely do you think it is that the government is going to meet even one of those demands?
Well, as of today, it's looking close to meeting several of them, actually. Word has leaked out that there is going to be a renewal of the program for the subsidy of home heating fuel to remove the GST, HST from that. That would be continued, and that was one of the key demands. And we're also seeing that there might be some relief on the family doctor front. While the NDP has asked for a significant increase in the number of family doctors available in Canada, and particularly in rural Canada and the north, what it's looking like now is that there is going to be some kind of a program for debt forgiveness for rural doctors and nurses of their student loans. Now, that we're not going to see an immediate increase in family doctors, so whether that's going to be sufficient to meet the needs of what the party has put forward, we're not sure. We'll certainly have a look at what's in it. However, there does not look like there is going to be any assistance for seniors. And one of the key and probably the most costly demand of the NDP was a significant increase to the guaranteed income supplement for seniors in need. And it is not looking like that aspect of the NDP request will be met. So I think the party is going to take a good hard look at what comes down tomorrow, but judging on what the word is right now, it's not looking like it's going to come anywhere close to meeting what we view as being a very necessary ingestion of funds into our senior security system for Canadian seniors.
And I take it that Mr. Flaherty hasn't had a change of heart, and there's no expansion of the CPP on the horizon, notwithstanding that the vast majority of the provinces supported that move.
Exactly. There hasn't been a whiff of any kind of increase to either the Canada Pension Plan, and in fact what we're seeing now is the federal government in fact offloading onto the private sector any expansion to what is a safety net for our seniors and upcoming seniors. And that, as we all know, is just putting more money into the pockets of Bay Street and not any money into the pockets of Canadians.
To change gears a little bit here, Susan, the parliamentary committee reported on two findings of contempt of Parliament, but of course the ODA affair is still outstanding. And for our listeners, the minister in that case originally told Parliament that CETA had denied funding to a church NGO organization, and then later that she wasn't aware who had modified the document to include a handwritten "not" above the funding approved. Later, Minister Oda did admit that, in fact, it was CETA had recommended the funding. It was her choice not to provide the funding, and that it was her chief of staff who had added the annotation, and in fact added it at her direction. What does this, is this an important incident for voters to care about, or is this something that only matters on Parliament Hill?
Well, I think if it's viewed in isolation, it might be something that people are willing to let pass. People make mistakes, they forget. But when you view it as part of a larger pattern of behavior, which I think you have to, on the part of the Conservatives, that is one of complete disdain and disrespect for Canadians and our parliamentary democracy. We've seen, as Minister Oda has exhibited, a definite high-handedness, a belief that one can get away with pretty much anything and say whatever one wants to And that's just not in our Canadian traditions. And so I think when you look at the pattern of behavior that we're seeing from not just Minister Oda, but the entire Conservative caucus, you're seeing one that is holding Canadians in contempt.
Given these findings of contempt of Parliament, given what I hear you saying about the budget in that it may have some of the things the NDP wanted to see, but likely nothing for seniors, I think it's fairly likely that we're going to see a spring election. Given that you're the candidate right here in Toronto Centre, what do you think the big issues are going to be for Toronto Centre voters if we are faced with a spring election?
Well, my sense at the door has always been that the issues that affect people in Toronto are reflected across the country, and that's what hits you in your wallet. The soaring energy costs coupled with a lack of job recovery in terms of the economy since the '08 recession. You know, sure, we've regained jobs, but are those jobs good jobs? Are those jobs well-paying jobs? Are those jobs that provide any benefits, or are they more likely to be for less money and for less benefits? Those are the issues. How am I going to pay the rent? How am I going to put food on the table? So that's always what affects Canadians first and foremost. Secondly, I think we're going to have, again, a debate about our national health care system in this election. We have to. It hasn't been on the radar for a while, but when you talk to people at the door, that is what they are talking of front of mind, is our Canadian healthcare system, and it is crumbling. It is suffering under a lack of infrastructure. We don't have enough doctors. We don't have enough resources. People are paying staggering amounts for prescription drugs. There is an absolute lack of adequate home care for our seniors who need help or who need assistance to stay in their homes. Those are the issues that I think people are going to talk about. And those are things that affect everyone, whether you are rich or poor. Those are things that hit home every day. So I think that's the conversation that we're going to be having over this election. But I also think that there will be a discussion about the ethics of this government and whether we can stand as a people to have them continue to run our country into the ground. If we can continue to have this government representing our values abroad, because we just don't see ourselves reflected anymore in the values that the Conservatives are putting forward to the world as representing us. So those are the things I think we're going to talk about. We're going to talk about the economy, our healthcare system, and our reputation internationally.
Thank you so much, Susan. Thank you for joining us this evening on Word of Mouth.
My absolute pleasure.
Been a pleasure on this end too, Susan.